Have you ever searched YouTube for health advice, only to find a dozen miracle cures, shocking headlines, and doctor approved hacks in the first few minutes? You're not alone. In 2025, more people than ever are getting their health information from YouTube, TikTok, and other social media. But here's the truth: the internet now is flooded with health misinformation. Some of it's just silly, and some of it's outright dangerous. Today, on this No Hype Health video podcast, I will give you a bigger picture. Why is health misinformation everywhere? Why is it so convincing? And most importantly, how you can protect yourself and your family from making a dangerous mistake. What is health misinformation and why is it so common online? Misinformation means wrong or misleading information, often disguised as advice, tips, or even breaking news. It can be about anything: vaccines, cancer, weight loss, fertility, nutrition, alternative medicine, or miracle supplements. But why does it spread so easily? Simple. Social media rewards content that's dramatic, emotional, and catchy, not accurate. The more shocking or hopeful the message, the faster it goes viral. You might think, surely most advice is at least a bit accurate, right? Not so. A major review published in the Journal of Medical Internet Research found health misinformation is everywhere on social media, especially for topics like vaccines, drug use, diets, and disease cures. In some areas, up to 87% of posts were inaccurate or misleading. And in 2021, the US Surgeon General called health misinformation a serious threat to public health, one that undermines trust, encourages risky decisions, and make it harder for people to get real care. The four biggest types of health misinformation online. Let's walk through the main four ways misinformation shows up and why each is a problem. Viral miracle cures and quick fixes. You've probably seen headlines like, "This fruit can cure cancer," "Alkaline water reverses aging," or "DIY supplements stop all inflammation overnight." But here's a real world example. During the COVID-19 pandemic, videos about drinking bleach, miracle mineral solution, or inhaling hydrogen peroxide as a cure for infection went viral. These claims were not only false, they were dangerous. People ended up in hospital because they believed and followed these so called cures. Another example: fad diets that promise one food to burn all belly fat, or home detox cleanses that claim to reset your body in 24 hours. There's no solid science to back these up, but because the stories are hopeful and simple, they spread quickly. Vaccines. Vaccines are one of the most targeted topics for misinformation. Videos and posts have claimed that COVID vaccines contain microchips, cause infertility, or rewrite your DNA. None of these are true, yet they have convinced millions of people to skip or delay vaccines, putting themselves and others at risk. The same kind of claims pop up about childhood vaccines, HPV vaccines, or even the annual flu shot. The harm is real. Outbreaks of measles, polio, and COVID have all been traced to groups who believed false stories online. Nutritional misinformation is everywhere. Superfoods that cure disease, extreme diets with no long term research, or miracle supplements for weight loss. One dangerous example is the rise of natural or herbal remedies promoted by influencers or even some doctors online. A well known US influencer promoted black salve a corrosive substance as a natural cure for skin cancer. Many people delayed proper medical treatment and some suffered serious burns and infections. Others push supplements with wild claims. This pill detoxes your liver, burns fat, or boosts memory overnight. These are rarely tested, sometimes dangerous, and always oversold. Number 4. Doctors, health professionals, and influencers who sensationalize or sell. Sadly, not all doctors or experts online are there to help. Some use their title or platform to sell expensive supplements, exclusive programs, or secret cures. The problem isn't just the product, it's the hype and false hope that comes with it. A well known case, the controversy over Dr. Oz promoting unproven weight loss products, and another example, telemedicine companies that overprescribe ADHD or anxiety medications after a quick online assessment spurred by aggressive advertising. ADHD, that's another topic on its own, which I'll discuss in the near future. Sometimes even trained health professionals let fame and profit come before patient well being. The real world harm. You might wonder, what's the worst that can happen? Sadly, people who believe and follow bad advice often delay or skip proven treatments. Some spend thousands of useless or unsafe remedies. Some lose trust in real doctors and the healthcare system. In the worst cases, people are injured or die because of dangerous cures they found online. Even more disappointing and dangerous is when people in public office pander to misinformation or actively reinforces it. When a government figure or public health leader repeats a viral falsehood, it gives the misinformation more power. And the more sexy or weird the claim is, the more people get seduced and sucked into its vortex. During the COVID pandemic, for example, thousands of people globally were hospitalized or poisoned by trying miracle cures that went viral on social media. Now, how to protect yourself and others from health misinformation. Let's finish with 4 practical tips. Start with your own health professional. If you're worried or have symptoms, talk to someone who knows your medical history. Check the source. Does the information come from a government health site, a university, or a major hospital? Or is it from an influencer trying to sell a product? 3. Be wary of miracle claims or simple fixes. If it sounds too good to be true, it probably is. 4. Don't share advice unless you're sure. Sharing viral content can spread harm, even if your intentions are good. Final thoughts. Social media is powerful. It can educate, connect, and raise awareness. But it can also spread confusion, false hope, and real harm. Your health deserves more than viral hype. Before you click, like, or share, pause. Look for the facts, not just the feelings. In our next episode, we'll dive deeper into mental health misinformation with a closer look at ADHD, autism, and the dangers of viral advice. Thanks for watching the Dr. Ho No Hype Health video podcast. Stay informed and stay safe.